I got to go introduce. Let's go ahead and get started with grand rounds this morning. It's our pleasure to welcome Dr. Francisco Cigarroa as our speaker this morning. Dr. Cigarroa is well known to this campus. Dr. Cigarroa grew up in Laredo, attended Nixon High School. From there he did his undergraduate at Yale, medical school at Southwestern, and then did his general surgery residency and pediatric surgery residency, our fellowship at Hopkins. He then came here on the faculty as an assistant professor, rose to the ranks of associate professor, and eventually became professor at the same time he was appointed or anointed to become president of this health science center. I believe 8 years as president? 9, 8 as chancellor. And then from there he bounced to Austin and became chancellor of the health system for UT, or the whole undergraduate campus as well. Dr. Cigarroa, during his tenure as chancellor, was instrumental in helping initiate the 2 medical schools, the one at UT Austin and UT Rio Grande Valley. And he presently serves in a role for the medical school, I think the chancellor appointment for the medical school in the Rio Grande Valley. Dr. Cigarroa has returned to campus. While he was chancellor and president, I think he operated at least once a month, one weekend every month, to keep up his clinical skills, and he has now returned to the flock and has returned to the division of transplant surgery with Dr. Health and is head of pediatric transplant surgery. Please help me welcome Dr. Cigarroa.
You think we can dim the lights just a little bit?
Yes. I forgot. He's also a member of the Institute of Medicine.
Okay. Well, Ken, thank you very much for that very kind introduction, and what a privilege it is to be able to speak before this distinguished faculty, many of whom have been my mentors. As Ken Serenik stated, I graduated from Yale in 1979 and had the privilege of matriculating into Southwestern Medical School in that summer. And like all of us in medical school, we're all exposed to some really transformative individuals who really shape your life through a lifetime. And I had the privilege of having the opportunity to be impacted by 2 faculty members at Southwestern. The first, Dr. Michael Brown, and then the second is Dr. Rupert Billingham. And it was Dr. Billingham who was my cell biology and histology teacher, but he also happened to be, one of our nation's greatest immunobiologists. In fact, was very much involved with understanding the mechanisms of graft versus host response in the immune rejection process with Dr. Medawar. And so I think my first interest in immunology and transplantation probably kindled as a result of those interactions. And then Dr. Michael Brown ended up being my attending in internal medicine at Parkland Hospital, who eventually became a Nobel laureate for understanding the mechanisms of hypercholesterolemia and the cholesterol receptor. But like every mentor, he takes an interest, or she takes an interest in a student. And he asked me, well, Cisco, what are you going to do, once you graduate from medical school? And I told him very straightforwardly that I was going to go back to Laredo and, practice surgery with my family in Laredo, Texas. And he was the very first person who encouraged me to pursue a career in academic medicine. I had no idea what the heck that was, but he said, you ought to probably try to apply to certain residency programs that can at least structure you into that direction. If you don't like it, you can always go to Laredo. So he, in fact, wrote my letter of recommendation to Massachusetts General Hospital. And when I got in, I was so excited that I came and I embraced him like an abrazo. And his response was, Cisco, don't disappoint me. I wrote your letter of recommendation. It wasn't really exactly the type of response I was expecting. But I did heed his recommendation, and I ended up going to Massachusetts General Hospital, which is really a terrific experience. It was a hospital that really treasured the relationship between a patient and a physician, but at the same time was very much involved with biomedical research and encouraged the residents to do so. So at Massachusetts General Hospital, I had the privilege of working in the laboratory with Dr. Patricia Donahoe and Dr. Judah Folkman, both involved in really trying to understand targeted therapies for the treatment of disease. So I worked both on the Mullerian inhibiting substance to try to determine targeted therapies for ovarian cancer, and then also on the angiogenesis factor on understanding, what types of proteins could actually stimulate the proliferation of blood vessels. And that, in fact, the work of Judah Folkman established a whole new chapter in our armamentarium for the treatment of certain metastatic diseases. So after Massachusetts General Hospital, I went to Johns Hopkins Hospital, where I ended up doing my fellowships in pediatric surgery and unexpectedly an additional fellowship in transplantation. I had no idea I was going to go into the field of transplantation, but as a pediatric surgeon, we got exposed to many patients with biliary atresia who ultimately needed to move on for transplantation in order to save their lives. And so as the pediatric surgical fellow, I would scrub in on those transplant cases. And then going back to those early years with Dr. Billingham, I decided that this was an area that really interested me immensely. And if I was going to do pediatric transplants, I didn't feel that just a pediatric surgeon by themselves, without extra experience, would probably be able to do this for the long run. And so I decided if I'm going to do it, I'm going to do a transplant fellowship. And I think to this day, I'm probably the only insane person who's done 2 fellowships in surgery at Johns Hopkins Hospital. Well, at Johns Hopkins Hospital, upon completing my fellowship, they asked me to stay on as the director of pediatric transplants. And I thought that this was probably, one of the greatest opportunities that a young individual, a young faculty member can get. But when I spoke to Graciela about this, she basically had other ideas. And she said, I think it's time to go back to Texas. And, the most important people in our lives were our grandparents, our parents, and our cousins. And we feel, or at least I feel pretty strongly that Christine and Barbara should grow up in Texas and be exposed to that family environment. Well, she was absolutely correct. And in fact, the greatest decision I ever made was to leave Johns Hopkins and come to the Health Science Center. And the reason that was such a great experience is just like in any other institution, you get exposed to great people. And I was fortunate to be mentored by 3 outstanding faculty members of this Health Science Center. Dr. Brad Oust, who is really our founding chairman of surgery, encouraged me to come to San Antonio. Dr. Arthur McPhee, who really ended up doing a lot of the pediatric surgery over here, mentored me as a young pediatric surgeon. And when I'd get frustrated, he'd tell me to calm down because there were definitely reasons to be frustrated in the areas of pediatric surgery in the early years. And then, of course, Glenn Half, who basically has been a partnership that I've cherished from the very first days that I came to the Health Science Center, where we had the opportunity to establish a pediatric transplant program that was far more comprehensive than just kidney transplants. And so we actually ended up doing several firsts here at the Health Science Center, whether it be involving multivisceral transplants or split liver transplants or living-related liver transplants. We had the opportunity to do that here in San Antonio in those early days in the mid-1990s. Well, let me just personalize 2 stories that also, make it such a wonderful experience to come back to San Antonio. And those are 2 patient stories that, basically resonate with being able to practice medicine in this area of the world. So one patient ended up coming in when I was probably in my 3rd year at the Health Science Center, who came in with significant hepatic insufficiency and renal insufficiency. And she ended up needing a liver and a kidney transplant. And it so happened to be that this patient helped raise, the 10 children that my mother had in Laredo. And so, in fact, we did a liver kidney transplant on a patient who probably changed my diapers. So what are the chances of that happening, in the area of medicine? And it really basically impacted, this wonderful decision of coming back to really help the citizens of South Texas. And the second story, which just kind of personalizes my love for the patients over here, is there was a patient about 4 years ago that I did a kidney transplant on. Never had met this patient before in my life, and had a name by the name of Erasmo, which, Candy, you don't hear that name that often anymore. And so the following morning, I spoke to this patient, Raul, and I said, I don't hear the name Erasmo that often anymore. And he was about a 70-year-old gentleman. He goes, well, yeah, the mamas just aren't naming their young boys Erasmo anymore. I said, well, I had an uncle, a great uncle named Erasmo. But he was actually from Mexico. And he goes, well, was he from Hidalgo, Mexico? I go, no, he was from Nuevo Laredo. He goes, well, did he have a brother named Emeterio? And that's another unusual name. And I go, well, yeah, he was my grandfather. And so now I'm trying to figure out how this patient knows my family. And so he goes, well, I used to make the ranch roads for the ranches in that part of northern Mexico, and I used to make the lakes. So I used to drive the tractor, for those ranches, and I worked for your grandfather. I said, isn't that amazing? So do you remember a 5-year-old kid who wanted to drive that tractor and was crying and crying and crying? He goes, yeah, I remember that kid. I said, well, that was me. He goes, his response was, I'm glad I let you drive the tractor. You might have done a terrible kidney transplant. But, what are the chances of being able to come back, to a great health science center and be involved in the care of these patients? And I think the story to the medical students is always get to know your patients. You will find some unbelievable, stories that have such an impact on your life. Well, just a little bit about a historical perspective relevant to my views as an administrator, as an educator, and as a physician. I'm a third-generation physician. My grandfather practiced medicine in San Antonio and Laredo. And when I was a boy, he provided me with a tremendous experience in understanding the challenges that really face this population in a profoundly medically underserved region. As we all know, the Texas-Mexico border region is still a region with significant healthcare disparities, many of which are public health issues that face this nation. So in shadowing my father as he made house calls and seeing his love for his practice, I received a firsthand view not only of the beautiful art of medicine, but how this art profoundly touches all classes, from the poorest to the wealthiest, without regard to economic status or homeland of origin. So my father, to this day, is still practicing medicine in the same city he started his practice in 1947. And to this day, he still comes home with a smile every day about the wonderful experiences he had with his patients. So there's no doubt as to why many of his children ended up going into medicine, because he personifies the love of medicine every day. So my first position after Johns Hopkins Hospital was really to come down to San Antonio to basically head, it wasn't even a division then, but really essentially pediatric surgery, and then also to work with Glenn Howe to establish a pediatric liver transplant program. And I do believe that those successes really basically set the stage for me to become the president of the Health Science Center. So in the year 2000, the UT Board of Regents conducted a search for a new president at the Health Science Center, and my name was thrown into that hat. However, I wasn't interested in administration. I never really have liked long meetings. But my father and my brother Ricardo drove to San Antonio one day and asked, well, what are you going to do about this? Because my father was blind copied on the nomination letter since he previously worked for the coordinating board. Well, he basically said you ought not to be disrespectful to the Board of Regents, and you ought to at least go through the process. And so I asked my father, well, what do you think the odds are of this? And he goes, well, about 1 in a million. I go, well, I like those odds, because certainly I don't want to do that job. So, this thing happened. Suddenly that 1 in a million became, 1 in 4, and ended up interviewing for this presidency role, and I ended up getting it. I can't tell you the experience or the fright that I felt, when Charlie Mullins, who was then the EVC for Health Affairs, said, well, good afternoon, Mr. President. And I realized that this whole kind of experience, this 1 in a million, became 100%. So I knew this was not going to be an easy process, and I figured I'd have 3 months to get some experience and perhaps, take an executive leadership course at Harvard in business and so forth. What I wasn't expecting was a phone call 48 hours later to say, you're starting on Monday. I said, what do you mean? Monday 3 months from now or January? No. Monday, the following weekend. And so there was really no time to prepare, and ended up going to see Dr. Austin, who was my chairman of surgery at Massachusetts General Hospital, because there was still about a 21-day period before the board actually had to finalize your vote. And I asked him, well, Jerry, because he became chairman of surgery at the age of 38, I go, well, should I take this job? And he goes, well, absolutely. But I only have one recommendation for you, is don't give up your day job. Take surgery every weekend, because you never know. I go, well, that sounds like the statement that Michael Brown gave me, is don't disappoint me. He said, you better take surgery just in case things don't work out. And that, in fact, ended up being the very best decision I ever made, because it made me a better administrator. That is, taking call every other weekend while I was here as president. It connected you with the faculty and the residents and the students. And also it gave you leverage to always try to make the right decisions for the right reasons, because your life was not dependent on administration. And so I carried that responsibility through my entire tenure as chancellor. Well, after 9 successful years as president of the Health Science Center, I decided to go back to pediatric surgery and transplants. And just, I guess the teaching points I'd like to make to this group about being a president or being an administrator is that surgery is really the best training grounds for administration, in the sense that the world of surgery in the operating room is essentially the world of administration in a macro level. For example, if you're doing complex surgery, you have to work as a team. You have to have an accountable person, which is a surgeon. And you have to inspire people around you to do their very best. And if you make a mistake, you fess up to it, you're honest, and you're always striving for continual improvement. Well, those same principles are the same principles that work in administration, in the sense of surrounding yourself with the very best team that you can provide, inspiring those around you, being honest, and always striving for continual improvement. So in fact, this transition was not as hard as I thought it was going to be. So in my tenure as president of the Health Science Center, we were able to increase our overall budget from about $350 million a year to nearly $700. So the university grew from a budgetary perspective. We grew our endowment from about $250 million to $400 million. Our research expenditures increased from 85 to 210 million. Our total numbers of graduates increased from 17,000 to 26,000. We grew our members of the national academies from 1 to 5, and our awards from the NIH more than doubled from 50 to 110 million. And we were able to preserve our NCI designated cancer center status, which in fact, in those 9 years is probably the most challenging problem that I had to face as president of the Health Science Center. So I was enormously proud of Health Science Center's growth and its accomplishments. And so after those 9 years, I met with Glenn. I said, Glenn, I think my time is up as president. I've really done everything I wanted to do, and I'd like to come back. And Glenn, as always, welcomed me back. What I wasn't expecting was a phone call about 2 months later by the chairman of the board, Scott Cavan. And Scott asked me, Cisco, would you be willing to interview for the position of chancellor of the University of Texas system? And I just could not believe I was hearing this, because it took a whole summer for me to make this decision of finally stepping down as president of the Health Science Center. So I drove down to Laredo and had a conversation with Dad, just as I did when I became president, and spoke to him about my desire to go back to surgery. And so it must have been about an hour conversation, and went very well. And so then I bump into my brother Ricky, who's kind of like my sidekick, and he goes, "Well, how did that conversation with Dad go?" It went really well. He said, "Well, did he give you a hug?" Okay, that's where I got it. And I told Ricky, "No, he gave me a firm handshake." He goes, "Well, that meeting went terrible." Just went absolutely terrible. Bro, you ought to just interview for this job. Just flunk the interview, and at least, Dad could say his son, interviewed for the chancellorship of UT. And so I said, "Well, brother, that's not a good enough reason to do this." But it made me start thinking. And, I realized that in 2008, when we were undergoing a significant amount of healthcare reform, and 2/3 of our budget in the UT system comes from our health institutions. So a $15 billion budget, 2/3 of that is from our health science centers. And then third, from a selfish reason, I felt maybe a physician ought to be in the chancellor's office during this time of healthcare reform to make sure that we protect our health science centers. And then finally, probably the most important reason is that education saves lives. In fact, education is probably one of the greatest public health initiatives in the world to improve the quality of life. So based on those three principles, I felt that it was probably a good idea to interview, and to interview seriously, for the job. At the same time, I was getting feedback from previous regents who heard of this, who said, "Cisco, you do not want to do that job. That is the worst job in America. It's highly political. Everybody gets killed. You just want to run away from that." But those three principles about, really managing our health institutions during this time of great change, and the most important one is that education saves lives. I said, well, I'm going to have to do this. So I interviewed for that job, and I actually ended up getting it. But just like before, I told the regents that I'll take the job as long as you allow me to take call at least every third weekend, and they agreed to that, because I never wanted to be dependent on administration. Because surgery is my passion, running a university system is a privilege and a profound responsibility, and I'm comfortable in both worlds, but there's been nothing to this day that I love more than taking care of patients. So before I go any further, let me just give you a picture of the University of Texas system. There are 15 institutions under UT, 9 academic campuses, and 6 health science centers. UT Austin's ranked as one of the top 16 public universities in America. MD Anderson remains one of the top cancer hospitals in the entire world. El Paso produces most Hispanic PhD graduates in the nation. Under the UT system, we have over 215,000 students on any one day, more than 19,000 faculty, 69,000 staff members, and a budget that's now approaching $16 billion. And chances are that if you see a physician in this state, that physician was educated in the University of Texas, because 2/3 of all physicians are educated by UT in the state of Texas, and 3/4 of all residents in the state of Texas are educated by one of our health science centers or hospitals in this state. Our research expenditures exceed $2.5 billion, and our faculty across the system have 7 Nobel laureates and about 300 members of the distinguished national academies. And for the second consecutive year, philanthropy exceeds $1.2 billion across our campuses. Now, there's a great opportunity there before us, because 75% of that $1.5 billion comes from 3 institutions: UT Austin, MD Anderson, and Southwestern. So if we can even improve philanthropy at our other institutions by about 5 or 10%, That's a huge win for the system. So serving as chancellor of the UT system was challenging, and as the first Hispanic chancellor in the history of UT, I was aware that I was not only making history, but that I can hopefully help position others to follow. So let me tell you a few things about the development of higher education in the state of Texas, at UT Austin, and across our health science centers. So the Texas Constitution of 1876 specified that the legislature was to establish and provide for the maintenance and support of a university of the first class, to be located by the vote of the people. In 1881, Texas voters chose Austin for the site of the main university and Galveston for the location of the medical branch. And at that time, Galveston was the busiest city in the state of Texas. Another major outcome of the Texas Constitution of 1876, which I think was probably the most important decision for the UT system to this day, was the establishment of the Permanent University Fund. We usually refer to this by the acronym PUF. It is a public endowment that provides financial support to both the University of Texas and Texas A&M. The PUF, in my eyes, is a thing of beauty because with its impressive diversity of revenue sources from 2 million acres of land in West Texas that the legislature set aside in the 19th century for higher education. In fact, the reason why we received these 2 million acres of land is that the legislature just could not stand UT administrators coming before it asking for money every 2 years. Well, nothing has changed. But they said, here are 2 million acres of land, you go graze cattle, you go figure it out, you derive revenue from this, and don't come back. So those are the same statements you hear every 2 years. Well, they had no idea that they were giving us 2 million acres of land full of oil and gas. I guarantee you if they knew that, we would have never received those 2 million acres of land. So now this Permanent University Fund ends up being one of the greatest gifts that we're able to provide our campuses. Asheville Smith, this is an individual I have a great affinity for. He was the president, he was the first chairman of the board of regents of the University of Texas. And because of his remarkable leadership, he's known as the father of the University of Texas, but he's also the father of Texas medicine. He was a physician. In Galveston's epidemic of the yellow fever in 1839, he treated the sick. He published reports from this disease in the Galveston News, and he wrote the first treatise on yellow fever in Texas. So there's no doubt that as a result of the leadership of Asheville Smith and his colleagues in medicine, Galveston became a center of medical education even before the Civil War. In fact, he practiced medicine in Galveston. I might also add that the University of Texas Medical Branch was really our first medical school that included diversity as an important mission. They matriculated the first African American and the first Hispanic medical student in the state of Texas. And fortunately now, all our health science centers across the state are well known for its diversity. The only problem with that is that diversity at the level of administrative leadership, whether it's department chairs or deans or provosts or presidents, is still woefully inadequate. So it's really up to us as faculty to do what Michael Brown and others have done, which is really to sit down with young medical students and ask them about what their interests are in their professional life and, would you be interested in a career in academic medicine? Because many first-time generation students have no concept of what academic medicine is about, and if we are ready to diversify universities to its full extent, we really also need to diversify leadership. So perhaps after Chancellor McRaven finishes his tenure, perhaps a woman faculty member from this Department of Surgery can become the next Chancellor of the University of Texas. Well, I admire Asheville Smith because he was a steadfast supporter of education at all levels, but especially higher education and medical training. I'm also honored to be an Aspel Smith professor. So at the ceremony to lay the cornerstone for the old main building on what would become the University of Texas campus, Aspel Smith said prophetically, "Smite the rocks with a rod of knowledge, and fountains of unstinted wealth will gush forth." He was a grand orator, but I'm not sure he knew what in fact he said, because 40 years later, in 1923, oil would be discovered in our university lands in West Texas, where the Santa Rita oil well gushed forth fountains of wealth. So Aspel Smith had no idea at that time that there was oil and gas underneath those 2 million acres of land. So the 2 million acres of West Texas desert and prairie lands that the state legislature gave to the people of Texas as an investment for their public university became the miracle of the University of Texas endowment. Well, an interesting footnote, during the Depression, the University of Texas system and the Texas A&M system were losing money because they had to subsidize the operations of these 2 million acres of land. And so in fact, they made a decision that they were going to sell these 2 million acres of land. Well, this story will tell you that one person can make a huge difference, because there was a geologist by the name of Johann Uden who called the chairman of the Board of Regents who said, "You know, I don't think you ought to sell this land. I truly feel there's oil and gas underneath this desert land." And that's all it took for this chairman of the board to scratch the agenda item off the Board of Regents, because he was a rancher and he didn't really believe in selling land, but he had 8 regents telling him that we ought to sell the land. So when John Uden told him, "Don't sell this land because I believe there is oil and gas," the chairman of the board's got the power to put what's on the agenda, and that person's got the power to delete agenda items, so he deleted it. Well, imagine if he would have put this forth before the agenda of the Board of Regents and they would have sold this land. I can promise you the University of Texas would look very different today than it did if that action would have happened. So now the Permanent University Fund is valued at $17 billion, and it's responsible for many of the buildings that we have across the University of Texas system. So for here, just the academic building is predominantly being completely funded by permanent university funds. So today, 135 years after the PUF was created, the UT system has 15 campuses that are educating and training a new generation of students doing world-class research that is improving the quality of life in our state. So the University of Texas system is much to celebrate. Our institutions are strong and they are world-class, following their own trajectories towards excellence. But quality, as we all know, is a moving target. And so for 4 years, the UT system underwent a self-examination of the way our institutions were performing and how we can improve them. And so in the summer of 2011, the UT system introduced several initiatives that are changing the environment in higher education. And so we become a model not only for Texas, but for the entire nation. And to give you some examples, we established a framework for advancing excellence. Now, this framework was also established at a time of great debate at the University of Texas, because about 4 years ago, there was a huge debate as to what is the role of research and education. And it caused and stirred great debate across the Longhorn Nation. And so nobody really knew where all this was going. But as a surgeon, I knew that if I didn't take control of this, it would be directed at us. And so that was the genesis of establishing a framework for advancing excellence that really focused on 9 principles. That was to enhance access to our students across the state to come to our universities, to improve four-year graduation rates, because the four-year graduation rate at our flagship is only 53%, when it should be at least 75%. And of course, to lower costs. We also wanted to provide a framework that allowed us to recruit the very best faculty across the state, and that's the reason why we enhanced funding for STARS, which is really significant startup packages in the areas of equipment and renovations in lab for our faculty. We provided the greatest teaching awards for the University of Texas in the nation. And we established prestigious academies to really value, the mission of teaching as well. We enhanced our efforts to improve research by really providing important funding for all our 15 institutions. Of course, we had to contain costs, and so we established shared services across the UT system. We ended up having to also enhance our IT infrastructure because really the future of medicine in many ways is going to high-performance computing. If you're going to really understand big data, you've got to have the computational power to do that. We wanted to enhance philanthropic success, and we also wanted to be more focused on improving the time for PhD degrees because, taking 9 years to get a PhD degree in this environment is just really not adequate. And so we were the first system of higher education to establish memorandums of agreement between a faculty member and a student and define the responsibilities of both. And so now we're really improving the time to degree for PhD students. The eighth framework, or the eighth goal in the framework, was to improve the health of Texas. And finally, to expand educational and health opportunities in South Texas. And I'm glad to say that upon completing my tenure as Chancellor, 100% of those 9 goals, were already under full implementation. Well, we were also getting great emphasis by the board that we needed to basically leapfrog in the areas of online and blended online learning. And when I took a look at the capacities and the capabilities of the UT system, we were getting a D in regards to our ability to do blended and online learning. And at the same time, the regents were really pushing us to do better. So one of the very first things I did was to visit with Anant Agarwal, who is the CEO of edX, which is really basically a electronic platform to establish massive open online courses. And it was really a partnership between MIT and Harvard. And so I asked him, what do you think about UT system being a part of edX? And he loved the idea because he felt that the reason why he started edX was to really have access to more students who just did not have the abilities to go to a first-class institution. And so we became the first system of education in America to join edX. We had UT Austin establish 9 massive open online courses. And to this day, we have more than 300,000 students worldwide taking UT courses online. Now, these massive open online courses are just a small aspect of the portfolio of blended and online learning, but the fact is we're now recognized in the United States as leaders in this area, but there's more to be done. The Transformations in Medical and Education initiative was really something that I saw here as president of the Health Science Center, is that I saw inadequate interactions between UTSA and the Health Science Center in the sense of having a seamless way of matriculating students from UTSA to the Health Science Center. In fact, we weren't admitting that many students from UTSA in those early days. But I felt that we could do better across the UT system, enhancing our abilities to work with our academic campuses. And also understanding that very little was being done in medical innovation following the Flexner report. So for 100 years, medical education was really more or less about the same. And so we established, through an $8 million contribution by the board, the TIME initiative, which now really brings together our academic campuses and our health science centers to really educate our students in a more seamless manner from academic to our health science centers. So now, rather than 8 years, we can decrease that time to degree to perhaps 7, and in some cases 6 years without compromising excellence. And so again, we just an article got published last week on the leadership of UT system in innovations in medical education, and we're very, very proud of what our academic and our health campuses are doing. Engineering. I had no idea, what the demands of engineering were across the state. And this goes back to a request by the University of Texas at Austin asking the legislature for $300 million in tuition revenue bonds to build their new engineering building at UT Austin. And so the legislature failed to actually fund tuition revenue bonds at that time. In fact, they haven't funded tuition revenue bonds now for over 11 years. I think this will perhaps be the year that they fund it. But anyhow, UT Austin was really at a great disadvantage in regards to competing with MIT and the other top engineering schools because their engineering building was really in seriously deconditioned shape. At the same time, the relationship between UT Austin and the board wasn't exactly the best. And so when TRBs failed, the president asked the board, for $150 million in permanent university funds. And the board really wanted more data. Why do you need this money? What is the demand? And they looked upon me. I said, well, I can tell you how many medical students we need. I can tell you how many residents we need in the state, but I have no idea how many engineers we need in the state. Well, we put together this task force, and we realized that the state of Texas needed 9,000 more engineers every year for the next 10 years, just to meet the demands of this growing state. And so with that compelling argument, we were able to convince the board to allocate $150 million of permanent university funds to UT Austin. And now that building is underway, and it will protect UT Austin's Cockrell School of Engineering to be, one of the top 5 engineering schools in this country. But the story there is always be prepared, get your homework done, and if you can have a compelling argument, you'll usually prevail before a board of regents. Clinical safety and effectiveness became very important to me as chancellor. And so we established a Center for Clinical Safety and Effectiveness across the UT system. Health Science Center of San Antonio, through Jan Patterson, has been a champion in this area. But now when you take a look at our health institutions and our hospitals across the state that are part of the University of Texas, our patient safety outcomes are remarkably terrific. And so we've become a model of how to improve patient safety and patient outcomes for other systems of higher education by establishing this formal entity. The other thing I thought that was very important was to establish an academy of distinguished teachers, both for our academic campuses and our health campuses. I really felt that our teachers were still being undervalued. And so we got the Board of Regents to allocate significant funding to really recognize outstanding teachers, and in fact reward them with a $25,000 teaching award if they got selected for this academy by their peers. And then if you actually are defined as a master teacher, then your work doesn't stop by just that accomplishment. You become a member of the Teaching Academy of the University of Texas so that you can share your best practices with other teachers. And these symposiums are open to all faculty across the University of Texas. And if we are really going to excel in blended and online learning and hybrid courses, there's a lot to be learned about how to do that. And the best forum is to learn from your peers. And now this has become one of the most popular academies under the UT system. And in fact, recently, the faculty at UT Austin and the Academy Master Teachers for the academic side put together, rather than the little red book for golf, that I think Harvey, who's our wonderful golfer? Anyhow, I forget his name right now, but they paralleled that book now for the Pearls of Teaching for the University of Texas, and it's really been embraced by everybody. Well, the Dell Medical School and UT RGV School of Medicine. This was a very interesting time in the University of Texas. So there was great emphasis by Austin that they wanted a medical school. UT Austin was unsure whether this was a good idea or not because the deans of the colleges of UT Austin were terrified that it would take many resources away from them. So even though you and I think it's a slam dunk, there was a bit of resistance. At the same time, the coordinating board in 2002 stated that if you're going to build a new medical school in Texas, there ought to be one in El Paso, there ought to be one in the Rio Grande Valley. They never really recognized Austin as a site for a medical school. And at the same time, I was seeing Texas A&M coming closer and closer to Austin. And I love my Aggie friends. On the other hand, I was wearing my Chancellor hat, and I wasn't about to have Texas A&M build a medical school behind my backyard as Chancellor of UT. But that was just the competitive spirit. But the fact is that somebody was going to do it. And the fact is also recognized that if you truly wanted to make UT Austin America's finest public university, it could not achieve that goal without a medical school. And then you also have to realize that if you were going to make that happen, you had to actually find the support to get the medical school in South Texas. And so one of the things that I did, and the regents really didn't understand South Texas very well. They never really spent a lot of time in South Texas. Everybody understands UT Austin. Nobody really understands, to the fullest extent, other areas of the state. So in this framework for advancing excellence that I got the board to unanimously approve, I actually put in that framework the importance of establishing a medical school in South Texas. So the board, whether they knew it or not, approved the medical school for South Texas by approving the framework. And so they really could not go back, on their vote. And so we got the Texas legislature, both South Texas and Central Texas, to at the same time support these two medical schools. And fortunately, they both got approved. And so now we have the Dell Medical School, which will position UT Austin as America's finest public university. We got the legislature to approve the medical school in South Texas. That could be all talk in and of itself. We were able to recruit Clay Johnston from UCSF to be the founding dean of the medical school in Austin. Really a terrific individual who really basically wants to really innovate basically how healthcare is established in Texas. Now, the medical school at UT Austin is not funded by the state at this time. The way we got funding for that was for the board to allocate $30 million a year and to be matched by a property tax or by the Central Health District in Austin. So the people of Central Texas had to vote, an increase in their tax base to get this done. South Texas, on the other hand, is an impoverished region, which does require state legislative support. So a little bit about South Texas. We in San Antonio are really largely responsible for the success of any efforts in South Texas. This started by the establishment of the Regional Academic Health Center. This was a slow process, but once South Texas realized that Dell Medical School was coming about, they really kind of united themselves to help us also get the South Texas Medical School. So UT Rio Grande Valley, how in the world did this happen? Because this was not actually on my horizon, or at least I didn't expect this to happen. What happened here is that University of Texas Brownsville and Texas Southmost College had a 20-year partnership that fell apart. The Texas Southmost College is a community college that basically worked hand in hand with UT Brownsville. Trustees changed with politics, and the trustees of the community college said, we no longer want to report to the Board of Regents. We want our own board, we want our own control, and we want a divorce from the University of Texas. And I said, wow. And so we tried to negotiate and mediate, and at the end of the day, we ended up getting a divorce because we weren't going to relinquish, our oversight of our campus to a community college board. And so it ended up being actually a difficult process. But during that time, when that divorce happened, UT Brownsville lost over $20 million a year of funding. So now you're thinking about legislature cutting everybody's budget, losing $20 million a year in the poorest area of Texas and little philanthropy. And the board and the president saying, we're going to become a university of the 21st century. And me being a realist saying, you're setting false expectations. You are telling people you're going to do something that at the end of the day is a dream, because it's not going to happen if you don't have the resources. So I put together, a team, and I brought the people into my office at UT Austin, and I said, we are not leaving here until we figure out how to actually provide Brownsville permanent university funds. Because, believe it or not, there were only 2 campuses out of these 15 campuses under UT that were not eligible for permanent university funds. And what campuses are that? Brownsville and Pan Am. In the 2 poorest areas of the state, 95% Hispanic, and in many ways was a social inequity. Imagine being president, Ken, of UT Brownsville and UTSA getting all this puff money, but you're not eligible to get a penny. I mean, you're part of the family, but you're really not. So, and you may ask, well, why aren't they eligible for puff? Well, it ended up being because Pan Am and Brownsville got acquired as community colleges into the University of Texas system. And if you get acquired, you're not eligible for puff. If you create a new university, you're eligible for puff. So every lawyer, everybody was saying it's impossible to give these 2 campuses puff. I go, well, we're not leaving here until you figure out a way, because I brought my sleeping bag, and I was serious. Well, finally, there was a gentleman by the name of Steve Collins who ended up being a parliamentarian for the Texas legislature for over 20 years. So he knew everything about the Constitution. And so he finally raised his hand, and I said, Steve, do you have a solution? He goes, yeah, the solution's easy. Create a new university. So what do you mean by that? He goes, well, bring Pan Am, bring Brownsville, and bring the medical school under one umbrella. Call it a new name, have one president, get 2/3 of the vote by the legislature, and you get puff. So we actually ended up doing that. And within 9 months, we created this new university. And a year later, they got over $300 million of funding from the Board of Regents for the very first time in the history of Texas. And so now we've got a medical school that is now eligible for puff as well, and a region that will be transformed over time. So the people of South Texas ended up actually wanting to name their university the University of Texas Rio Grande Valley. And so now, over the next 10 years, we will see this university transform itself. So they just received, the medical school in South Texas just got its candidacy to be reviewed by the LCME, and UTRGV will be accredited as an independent university next year, and they've already matriculated their first students, or they've accepted their first students. And once this gets done, it'll be the 2nd largest Hispanic serving institution in America. Now, you haven't lived until you have to kill 2 mascots and create a new mascot. So there was a civil war about sunsetting the Broncos at UT Pan Am, and then basically putting the ocelots into extinction in Brownsville. And this was really 3 months of just warfare. Finally, the new mascot is now the Vaqueros, or the Vaqueras, and the name of the university, UTRGV. But this was a very contentious issue. And now, as we all know, Francisco Fernandez is the dean of the medical school at UTRGV. They're now a candidacy school, as I've stated, for a medical school, and they'll be getting their formal site visit in July of this year. Well, in closing, I'm going to just tell you, make no little plans. So Daniel Burnham, one of America's premier architects at the beginning of the 20th century, once said, make no little plans. They have no magic to stir men's blood, and probably in and of themselves will not be realized. So at UT System, make no little plans could be our guiding principle. The stereotype of Texans is that we are given to exaggeration, but it is no exaggeration to say that the aspirations of the UT System are big and they are bold. So every day at our 9 academic institutions, and our 6 health science centers, we're implementing innovations that create a stronger learning environment, improve the undergraduate experience, contribute world-class research, render public service, and provide nationally acclaimed medical training and patient treatment. We are saving lives, and we are shaping lives. We are transforming the world in which we live. Well, it was a great privilege for me to serve as Chancellor at the UT system. I've always been very focused upon completing my goals that I set out, which I set those 9 principles in the framework for advancing excellence. Once I completed that, and once we established the 2 medical schools and the new university, I told myself my job is done. And so in February of last year, I let Chairman Paul Foster know that I'm coming back to surgery. Please embark upon a search, because upon completing my 6th year as Chancellor, I'll be a full-time faculty member again at the Health Science Center. So I kept my word. I completed my 6 years. I came back to Health Science Center in San Antonio, and now it's just a joy to be able to be here among my colleagues and having the privilege of being involved in the education of our medical students and our residents. So it's been a great ride, but my adrenaline is surging now in this new chapter in my life. And thank you very much for allowing me to give this presentation. Be happy to answer any questions.
Well, that's good. You solved the problem in Brownsville and the Rio Grande Valley with diplomacy. You mentioned if I had been head of Brownsville, we would have marched to Austin and beat up all those sissies. Convinced them to come around to our way of thinking. Dr. Oust was always quick to point out that the PUF fund made us the #1 university as far as an endowment for state universities. Is that true?
Actually, if you take a look at the full endowment at the University of Texas, the endowment is comprised of the PUF, but also from philanthropy from citizens. So that is about a $35 billion endowment. And in fact, we equal Harvard and Yale in the overall endowment. The difference is we have 230,000 students. They have 30,000, 40,000 students combined. So, the impact of that endowment across 15 campuses is very different than the impact of that endowment for one university.
I know Dr. Oust told us that when they were getting $3 a barrel, the University of Texas was getting $1 out of every $3 a barrel.
But it is a differentiating factor from our other systems of higher education in America. We're at a great advantage.
Dr. Dent?
I was just going to ask, with some of the bad press that's coming out with online education, some of the big online schools are being sued and closed and things like that. I'm guessing there were some, key principles that had to be kind of laid out as the UT system embarked in online education, so we don't go down that path. Any brief thoughts on that?
Yeah, so many of these private universities, actually are eligible for federal grants. And the problem is that the graduation rates and the expense of these online courses, first of all, are exceedingly high, and the graduation rates are dismal. And so one of the things about being part of the University of Texas is that our costs to educate a student aren't that high. So the cost of an online course could be far more competitive than in the private universities. We're also very focused at the Institute of Transformational Learning to actually invest in student support systems that are really the coaches and the student support systems that are required to actually get students to actually succeed in these online courses. This is not an easy task. It's also not an inexpensive task, to get this done right the first time. And so there's still much more work to be done, but we've got a really good Institute of Transformational Learning that are focused on these issues. And